You know, we do have a serious issue in our society. Most of us assume, I think, many of us who've had kind of middle-class jobs throughout our lives, assume that most people get some sick leave, some vacation. If they have a family emergency, they can deal with it. But there's an awful lot of people in our workforce who don't get a single day of paid sick leave, who have no flexibility on the job. So when the school nurse calls, they can't go pick up their child. Or if they're sick themselves, they either have to decide, go to work sick and spread their disease to their coworkers and their customers and everyone else, or stay home, lose that day's pay, and risk actually losing their jobs as well. We've heard from the Centers for Disease Control, as well as through a number of other studies, that a really high percentage of nasty viruses get spread from sick food workers. At least half of the norovirus cases, and maybe as much as 80%, according to some of the latest studies, get spread by sick workers. And norovirus is what I think most of us think of as the stomach flu. The majority of people who work in restaurants, even people who work in Starbucks, don't get any sick leave at all. So they're among those people who are making that choice. Go to work when you're sick, or lose the pay, maybe risk losing your job too. That's not good for any of us. There is a pretty easy solution. Seattle a year ago passed a sick and safe leave ordinance that says all employers who have employees in the city of Seattle, if they have more than 4 employees, have to provide a minimum standard of paid sick leave. This is something where everyone has a stake in this, right? Everyone goes to restaurants, everyone goes grocery shopping. Shockingly, many grocery workers, even though in theory they may have some sick leave, oftentimes they can't use that sick leave until they're out for 3 days. That means they're making that decision if they have to take 2 days off without pay and get demerits in their file for every day that they miss. We've seen what happens when we leave it to the private sector to solve this problem. In fact, most employers do provide paid leave, but there are certain industries where without a standard in place, there are certain employers where without a standard in place, a pretty significant portion of the workforce is going to continue not to have any access to paid sick leave. That impacts the health and economic well-being of those families, but also all of us are impacted by that as well.